We're good to go, waiting for the participants to filter in. And I think, Jamie, if we give it like 30 seconds, it should be fine.
Okay, Mirella, over to you. I think everyone is in, and obviously some people will join a bit later. But over to you, Mirella. Thank you.
Thank you, Jamie. Good afternoon, good morning, and good evening to all of you. I'm Mirella Dumafrahi. I'm the chief of the Civil Society unit in the United Nations Office on Drugs and Crime. It's a great pleasure for me to say just a few words of welcoming remark to this webinar that will present our most important and successful flipchart publication, which is the World Drug Report. And this is the 2022 edition. I know that we had over 400 registry, so great interest. And this time I noticed among the NGO, but also like member states or experts that or just simple people who are curious and know what is the current trend has registered. And also I noticed the number of environmental crime or environmental NGOs, which are not usually like the main one with whom we work, or alternative development. So it's great. It means that we have one of the chapter that was devoted to environment, which is attracting a lot. So I'm, for those who don't know, the way we work in UNODC, the Civil Society unit is the entry point for civil society. And we have been working always through umbrella NGO organization. This is why this webinar is organized with the Vienna NGO committee. We share one project officer and who is in the background, Sarah, thank you for doing all the nitty-gritty work here to make sure everything works. I would leave the explanation on the technicality to Jamie, but be aware that there is interpretation in English, French, and Russian for those who want. I don't want to take more time because it's going to be a very, very interesting session. So we have here with us Angela May, the chief of the UNODC Research and Analysis Branch, and Kamran Niaz, who is the drug researcher, and they will provide you a highlight of this year drug report. It is great that we have been able to continue with this webinar. Of course, we are slowly coming back to in-person meeting, but it's so important to be able to do this kind of session where you can join us from everywhere in the world. And we will hear also after that two very interesting presentations, one from Pedro and one from Christina, who I would say as a survivor, because a person who knows really what's the reality in the ground can speak about the drug world problem. So I will stop here, and Jamie, the word is with you.
Thank you so much, Mirella, and welcome everybody. We've more than 100 people on this webinar, which is fantastic, and it's lovely to see people introducing themselves in the chat. So please do continue to do that. My name is Jamie Bridge. I'm the chair of the Vienna NGO Committee on Drugs, the VNGOC. And we're a global network of civil society organizations. We currently have nearly 350 members from 95 countries all around the world. And we're really pleased to be organizing webinars like this one, because really our role as the Vienna NGO committee is to try and provide a link between NGOs, between civil society and what's going on at the United Nations, particularly in Vienna. So we work very closely with Mirella and the Civil Society unit to do that. And today we are really, really thankful to Angela and Cameron from the UNODC research branch for making time for this today, because I think this is a really important conversation and a really important space for civil society to discuss and hear about the World Drug Report. So very quickly, before we go further, a few quick housekeeping things just to let everybody know. We are recording this webinar, mainly so that we can make it available to people who weren't able to join us at this time, because we're only doing this webinar once. And as Mirella has said, we have it available in different languages, English, French, Russian, and Spanish as well. You can select the language using the interpretation button. It's a small globe at the bottom of your screen, and you can select the language there and have the translation that you need. One of our speakers will be presenting in Spanish. If you want that to be translated into English, please select the English channel as well. So just to let you know in advance. And all throughout today's session, we have about an hour and a half together, but we have the Q&A option open on Zoom. So again, at the bottom of your screen, hopefully you'll see a Q&A icon. And we welcome your questions. Really, that's in many ways, that's the most important part of today's session is to get your questions. And we will be able to answer some of those at the end of the session. They could be questions to Angela or to Cameron or to our civil society speakers, and we'll address those at the end. And also our speakers will look at those questions throughout the session and try and answer some in writing as well. So please do use that option. I would ask you though, please don't put your question in the chat, because the chat moves so quickly with 124 people. It's really hard for us to see the questions and to not lose things. So if you do have a question, please use the Q&A. So yeah, just before I hand over to Angela, just to let everybody know, the World Drug Report, it is UNODC's flagship report. It is the global flagship report on drugs, and it's the major source of global data on this issue. It was launched very successfully on the 27th of June, and then there was also a CND special event on the 28th of June. So congratulations, Angela, on both of those. They were both fantastic events. But as I said, this is a really important opportunity for us as civil society to also get a chance to discuss the report and to learn about the report. And I think, Angela, this is the second time we've done this as a civil society thing, maybe the second or third. So, I hope that's something we can carry on in the future. And as Mirella says, doing this online means that people can join from all around the world. And I've seen in the chat we've got people from all corners of the world here today, which is fantastic. So without any further delay, very happy to hand over to Angela, who's going to, I think, share your screen. As I say, please do let us know if you have any questions as we proceed. So Angela, the floor is yours. Thank you.
Thank you, Jamil. Just to know if you see my slide?
Yep.
Yes. And
Perfect.
So a big thank you, Jamil, to you, Mirella, Sarah, for organizing this event. Really, the civil society, you are one of our main constituency. When we write the World Drug Report, we see in front of us member states, civil society, we also see academia, think tanks, and we really hope that you can find the report useful for your work, because you are the one that can make a difference to the people. And so when, we always say you are one of our agents to transmit the knowledge that we have produced to those that need that knowledge. I also wanted to tell you that our mission continues to be for the World Drug Report, to put together the best evidence that we can find. And so if you have any questions or even that we are not able to go through today, please feel free to write to us. If you see that we miss some evidence, or that we have misinterpreted some evidence, we really appreciate your feedback, and also feedback on what you find useful and what you don't find useful, because that helps us, to provide to you a better product. So what I will do, I will just to give you a flavor of the highlights on the main messages that we have. And also this year is so rich a report, as you can see, 5 booklets. And Cameron will then dig a little bit on the more, some of the aspects, but where I will dig, in addition to the providing the main findings, is on the cannabis legalization. We had a chapter on the impact of cannabis legalization. So let me start by the kind of headlines that we had. One is about cocaine and the record high cocaine production, almost 2,000 pure tons of cocaine. But what is also interesting, and that's what you see the map on the right, is the fact that we see now cocaine emerging and really expanding in what we call non-traditional cocaine markets outside of the North America or Europe. And these are seizures because these are information that are more easily available compared to demand. But we also have some information, for example, on treatment in Africa that suggests that definitely cocaine, not only now, as you can see here, the seizure are now going through Asia, Africa, but also they are also staying in terms of use. Then one question that we ask that it was also previous year, but I think we really make an effort this year to say what drugs is most harmful. And here you see on the left, you see the percentage of countries that reported the drug. You can see on the top, the drug that caused most of the drug use disorder in the country. Then you see in the middle, the drug-related deaths, and then you see down the drug-related treatment. And so something that we have highlighted also in previous reports is that opioids remain the most, if you want, deadly type of drugs, because most of the people really that die for drug-related deaths die for opioids. And you see here, the orange, indeed, almost 80% of the countries, they say most of the people die for opioids. But, the picture change if we look at drug use disorders and drug-related treatment. And you see that, for example, 40% of countries say cannabis is the drug that cause most of the drug use disorders, and 33% also said that of people in treatment. And as you can see from the right, what you see there on the bar charts on the right, the different colors are different drugs, and then they are grouped by region. And then you see for each region how over time the drugs that bring people to treatment, so the main drug for which people is in treatment, you see the different colors for different regions. And you see also how over time this shared percentage of people in treatment has changed. So I don't have the time to go region by region, but I think, to answer the question, what is the most harmful drug? It really also depends on what region and what country. Then one of the things that we have not done before has been to have estimates related to drug use by sex. And so to look at the difference of men and women drug use related indicators. And globally, we never had that estimate. So we always have presented overall estimates. And so what do you notice in this graph? So you see on the top, for example, the distribution of women and men across different drugs. And it's clear that, overall, and we see it in the data, overall, there are more men that use drugs than women. But you see that actually the distribution change across drugs. And for example, for no medical use of prescription of pharmaceutical stimulants or pharmaceutical opioids, there is almost gender parity. And down there in the one below, you see actually the distribution of cannabis user by region. So again, interesting also to note that the gender gap change across region. And then we have region like Asia, where less than 10% of cannabis users are women, while regions like North America, where there is almost gender parity. But what is again interesting to see is in treatment. So the proportion of people in treatment is very low. And so we compared the number of users by sex and the number of people in treatment by sex. And what is striking is, for example, for ATS, so for amphetamine type stimulants, we have almost again gender parity. So about 1 out of 2 drug user of ATS user is a woman, but in treatment, only 1 out of 5 person in treatment is a woman. So really suggesting that, I mean, there can be different reasons, but one definitely, this suggests a lack or a lower accessibility of women to treatment. Now, as Mirella mentioned, one of the focus, we have an whole booklet that deals with drugs and environment. And I don't have the time to go through all, but I really invite you to dig more and look at it. We'll just give you a flavor. And basically what we looked at plant-based drugs and synthetic. And really the conclusion that we had is that clearly are not drugs are not globally the challenge for environmental change, for climate change, for the threat to biodiversity. Because, you know, it remains, if you want, contain a small issue compared to the bigger environmental issue. But where it makes a difference is at local level. And just to give you an example, you see on the left, the concentration of dumping sites of synthetic drugs between Netherlands and Belgium. And you see really how that concentrate, and you will find in the booklet a lot of analysis on the impact of, for example, of dumping the waste of synthetic drugs that can be up to 30 times the amount of the drugs that are produced, and the impact of that this has on the soil, on the air, on water, and how the potential really impact on community, where, you know, there has been research also that link this to the food chain, for example, of that community. The other thing that we have looked is the plant-based drugs, and for example, we looked at deforestation, and directly, as you can see on the right, and this is based on 2 regions in Colombia, drugs are not, again, the big driver of deforestation in Colombia. You see that only 2% in Amazonia and 4% in Catatumbo that are directly relating to coca cultivation. But if we looked at more what we call the associated deforestation relating to coca is much wider, because in a way, coca provides the resources to farmers to then gain more space into the forest and then to engage in other agriculture activities. Then what we looked, so then what we have looked also is the impact in terms of carbon footprint. And you see here just the comparison and example. There's a lot in the booklet on this. But for example, this is the comparison of the carbon footprint of cocaine production compared to other crops that are typically cultivated where coca cultivation, where there is coca cultivation. And you can see clearly that in a way the production of cocaine has a much higher carbon footprint. Related to also the intensive type of agricultural practices for coca cultivation, because clearly it gives a very high profit. So there is an incentive to really cultivate and exploit the soil, exploit the plant with a lot of chemical, etc. And then there is the production of cocaine itself with the waste that is produced. Interesting to see also the difference of the carbon footprint for indoor and outdoor cannabis cultivation. And you see clearly how, big is the difference in relation to cannabis, indoor cannabis, and the larger carbon footprint that indoor cannabis cultivation has, that is mostly relating to the use of energy. You will find in the report, we got carried away with a little bit of, I think we compare the carbon footprint of the joint done inside, indoor or outdoor, compared to a cup of coffee. So it was just an interesting comparison. Another thing that we dig a bit, we have a chapter on drugs and conflict. And again, the complexity of how conflict can become, in a way, an opportunity for drug trafficking, and also an opportunity, and how drugs become an opportunity for parties to the conflict, to fuel the conflict. One of the main, if you want, messages that we have on this is that really how the conflict that we say can become a magnet for manufacture, particularly for synthetic drugs, because synthetic drugs can be manufactured everywhere. And we present the example of the Syria production of Captagon, and in Myanmar, the high production of methamphetamine. And the fact that they are both close to their biggest consumer market. Syria is very close to the Gulf, where is the largest consumer market for Captagon. And Myanmar, in Southeast Asia, we have the largest methamphetamine market in the world. And this is to warn also about what we need to monitor for the conflict in Ukraine. Because before the conflict, we had seen reported by Ukraine that the increase and the large number of laboratories of synthetic drugs that were seized again before the conflict. This is an indication that there is a capacity in the country for the production of synthetic drugs. So learning from what happened in our conflict, something to watch and to monitor whether the conflict also in Ukraine can become a magnet for synthetic drugs. The other thing that we looked, and you will find an analysis, is on Afghanistan. Of course, Afghanistan, as you can see, is where 86% of global opiates are produced in the world. So what happens in Afghanistan in terms of opium cultivation has an impact almost everywhere in the world, in virtually all regions in the world. And so what we did is to just think about the different scenarios that we have. None of us pretend to guess or to know how the future will look like. But clearly, there are particularly two contrasting scenarios that they are both very likely. One is the increase in production, a further increase in production due to the social and economic condition. If before the Taliban taking over already, we know that the lack of accessibility to basic services and low social and economic condition were driving opium cultivation. With the situation decreasing, clearly this may have an impact and increase further opium cultivation. Contrast to that is the possible impact of the drug ban that the Taliban announced in April, and how this will really play and how much that ban will be enforced by the Taliban. If there are no indication now that may affect drastically the harvest that is going on now in Afghanistan, but it could have a much larger impact on the next season. And so if there is a drastic reduction of production related to the ban, clearly there are implications not only inside Afghanistan, but further on. Again, I don't have the time to go to the details, but if you're interested, there is a lot in the report, and happy to have. The other thing that we look, and I have to say, is the first time we wanted to do some policy analysis. So the idea is to say, do some of the drug policy responses work, and how do they work? And so the big question is, does eradication work? And so I have to say, to initiate this debate and an evidence-based debate on this, we started to analyze and to see two different things. Again, I mean, the two, I'll explain, the two conditions are not strictly comparable, but again, it's to start a conversation. And we looked at forced eradication and the impact of forced eradication. And we saw that even if initially there's been, after the eradication, a decrease in coca density in the place where it's been eradicated and around, actually over time, that what we call eradication gain becomes really to a zero. And so that is in a way to say that in the long run, forced eradication has very limited impact. We have looked at, in contrast to the voluntary eradication associated to with alternative development programs. And that's what we saw is exactly in a way the opposite. So at the beginning, an increase in density of coca, probably for what we call the perversive incentives, but then overall seen that the eradication gain actually expand. And so that in the long run, the impact is more on the decrease of coca cultivation. Then we also looked at the impact of COVID, and wanted to focus here is just that we saw the confirmation with some more data on what we said last year. So that there has been an increase of cannabis consumption, but more than on the number of people that use cannabis, more on the frequency. So the same people using more cannabis. And also an increase in the non-medical use of some of the pharmaceutical, particularly tranquilizers and sedatives. But the most important element where we could see the data for 2020, and this is striking coming from all regions that where we receive the data, is that there has been a shortage of treatment services delivered. And again, that is clear in all the region where we saw the data. The other thing, not new, but just to remind everyone that we look at also the accessibility of controlled drugs for medical use. And again, the picture has not changed much. And still we have in North America that the number of doses available per million population in North America are 7,500 more than what is available in West and Central Africa. And in contrast to this, we have, that's why we say the too much or too little. In contrast, we have a record high overdoses death in the US and Canada, due particularly to fentanyls. Now, I conclude by just reminding you what you can find in terms of the impact of cannabis legalization. And one of the things that we have, basically this year, we always have a chapter that look at the trend. This year, we said, and you will find a lot of caveats in the report that says why we can't definitely answer the question, what is the impact of cannabis legalization, for a number of reasons, because some of the impact will be, we will see it in many more years, and many other caveats that you can find in the report. But this year we said, okay, but even with these caveats, is there something that we see emerging as a preliminary trend? And first of all, I just also wanted to say that one of the things that we have done this year is also to include a section on terminology and to really explain the difference between depenalization, decriminalization, legalization. But I hope that you can also use more also when in general, so that, at least we have a common language. And what we have also looked has been the medical, the accessibility accessibility of cannabis for medical use. And we looked at the countries that have provision for medical cannabis, compare those that have medical use of pharmaceutical with THC content, and those that they have the accessibility to cannabis herb. And it's about 64 countries that have both preparations and herb, and about 30 countries that have, the contrary, 64 countries that have preparation, and about 30 countries that have both preparation and herb. And so what, now, just to finish a few slides to tell you what is the conclusion that we had from the cannabis legalization. As I said, a lot of caveats first, and one of the caveats is in understanding the US market. And here you have an example of why is why we talk about the caveat. Because as you can see here, on the top is a trend in drug use past month cannabis use in the United States. And you see that, okay, looking at the long term, when the cannabis legalization happened, you see there is already, in a way, the market was going back to the increase. You see that the peak was in the 1970s. If we zoom, and then we see more closely, you see that when we look at different indicators of cannabis, the two lines on the top that goes up are relating to use, and the one down is relating to risk perception. You see that these changes didn't started when the cannabis legalization started, but earlier, particularly when in the United States open up to medical cannabis. But basically it was the accessibility, because many could also access for recreational use. And the same in Uruguay, as you can see on the right. You see, when the legalization happened, the trend was already on the going up. So with this situation, it's hard to understand what are the dynamics that happen after legalization related to the ongoing cannabis, the dynamic that were before on the cannabis market, and how much is relating to the legalization. In terms of, I think, user, what we really see and is emerging again across where the jurisdictions that have legalized cannabis is that probably what we can say with some confidence is that legalization has accelerated the increase that was already there, but mostly on frequency of use and therefore harm. So the more cannabis is used, of course, the more health harm is caused, more than the number of users. And here I just show you some examples of, for example, in Canada, it's interesting to see that if you see on the left, that's the use in Canada, and you see that the use for the first time in 2021 is going down, but it's going down for past user and from past year and past month, but for daily user is still going up. And this is also looking at the United States is a similar picture. And here, what do you see from the United States is the emergency department visit and the prevalence of cannabis use among pregnant women. Just to make the point that clearly we see an increased harm that is all related to the increase on use, and this dynamic that again was there before, and probably the legalization has accelerated. And where really the legalization seems not to have changed a lot in terms of number of users is among adolescents. And it's clear in the US and Canada. In Uruguay is a bit different, and you see a bit of an increase after legalization, but then a plateau after. And so while where there is more of an increase in terms of users, for example, in the United States, for example, is among young adult, so 18, 25, and also after 25. What really, and it's interesting again to see the question on risk perception, because risk perception also leads to use and affect use. And interesting, I showed you it earlier, for the United States, there has been clearly a decrease in the perception of cannabis risk. So more people that think that cannabis is not harmful. While you see in Canada, you see that actually after the legalization, there is an increase in the perception of risk. So meaning less people that consider cannabis as not risky. And you see also in Uruguay, look at the dotted line there in that chart. And then you see that actually after the legalization, the perception of cannabis started to increase. And one of the reason why some of the constituency argue for cannabis legalization is that cannabis could replace other type of substances. But again, here the data that we saw in the US is that there doesn't seem to be really a mix. I mean, the evidence is mixed on whether cannabis is a replacement for other psychoactive substances. In terms of market change, first of all, it's interesting to note the increase in THC content across the United States, but a similar increase that happened also in Europe. So again, how much is relating to the cannabis legalization and how much is related to what was there before. But what is clear that the cannabis legalization has triggered is in the market, is the presence in the market of very high THC content products, up to 70%. Something that is not visible in Uruguay. And so there are some differences that are also emerging on the different way cannabis has been legalized in the jurisdiction in the US, Canada, and Uruguay. And this is clearly an example of that in Uruguay, this high level THC doesn't seem to be emerging at the moment. In terms of the legal market, again, as you know, some of the claim was, well, legalize cannabis so that the illicit market disappear. Well, again, the picture is mixed. And in Canada, you see the bar chart there, and the dark color are the millions of Canadians that buy cannabis in the legal market. And you see that this is shrinking. So it means the legal market is shrinking. While the research shows that in California, for example, there is still a very large illicit market, 3/4 of the whole cannabis market. And in Uruguay is about half. And here what I wanted to highlight is also the influence of the private sector. And this is what seems the private sector leading to this high the diversification of the product, but also relating to the risk perception. And I finish with the criminal justice. And clearly, the impact of the criminal justice is clear. Less people that are arrested and that they go through the criminal justice due to cannabis. And that's, you see the bar chart on the left. But what is interesting to note is that first, one of the things that in the United States, you know, is very high in the policy agenda is the differential arrest between different ethnic groups. And cannabis legalization has definitely made decrease the number of people arrested in all ethical ethnicities, but the difference has remained and even has increased between the different ethnicities. And what is also very interesting to note is that while there is a clear impact on adults, there is not a clear impact on youth. As you know, where cannabis has been legalized, is still legalized for adults, not for minors. And then the number of young people that enter the criminal justice has not significantly changed. And actually, research done in the United States, in states that have decriminalized cannabis, is actually showing that there was a higher impact on youth than the impact on adult. Thank you. So over to Cameron.
Thanks, Angela. And Cameron, we've just a few minutes left of the allocated time. So I'll hand over to you, but then I do want to make sure we have time for Q&A as well at the end. So over to you, Cameron. Thank you.
Thank you. And yeah, so can you see the screen?
Yeah, thank you.
So in my presentation, I'll try to focus on some global overview of drug use, consequences of drug use, and some responses to drug use. And let me see. Okay. This slide kind of gives you a broader overview of what are the main substances or the main issues related to a particular substance in the different regions of the world, where you clearly see a blue in South and Central America, and you see more of a yellowish hue in Southeast Asia, showing use of methamphetamine, and then in the middle you see a mixture of opioids and amphetamine in parts of Asia and in Africa. So what I wanted to say was that looking at the regional picture, it tells you what are the major substances of concern in any of the given region. But then when we also look a bit deeper into this, we see that while there is a single substance of use that is of concern, polydrug use is also a very common pattern of drug use. And while we do try to somehow label regions by a particular type of drug, but in reality, all kinds of drugs are being used in the different regions, and polydrug use kind of like is the more defined pattern of use than a single drug use. So that's one element. Then why we want to talk about higher drug use among adolescents, because there is research that does show that adolescence is a critical period for substance use initiation, and then at that initiation of any substance use at that age can have more impact on the development of the people, as well as people who indulge, who initiate and then progress onto harmful use of drugs. There are more likelihood that they would be indulging in other healthy risk behaviors. So those are some of the important elements of why we need to talk about adolescent drug use, as well as why we need to talk about prevention of drug use. A very common set of information that we talk about, that you have nearly 11 million people using drugs, but and then nearly half of those people who use drugs are living with HIV, and about 1.4 million, or 1 in 8, are living with HIV. And then there is also a big chunk, 1 in 10, who are living both with HIV and hepatitis C. And on the right-hand screen, you see some of the regions that are of really concern, and especially Southwest Asia and Eastern Europe, that have a very high prevalence of people who inject drugs, but also living with HIV. So those are the kind of like regions that we need to focus more in provision of interventions and services. Why do we need to work more with some of the key populations in prevention of HIV and hepatitis C? You see, for instance, the prevalence of hepatitis C is much higher than people who inject drugs than in the general population, as one. And then if you look at the risk of HIV among the various key populations, you see that people who inject drugs, for instance, have a much higher likelihood of acquiring HIV than those who do not. And the same goes with some of the other key populations. So one of the reasons why we need to focus on some of the key populations in order to make more impact of the interventions that we have. getting into the interventions itself, this year we were able to look at some of the responses that are in place to address prevention of drug use, prevention of health consequences of drug use, as well as treatment of drug use disorders. And this first one tells you that while prevention intervention is a key component in many of the national policies on addressing drug use. But when we look at a mechanism to see if what kind of services are in place that are more based on evidence, and if there is an accreditation of the people who are providing prevention interventions, there is a big gap in that. So while there might be a lot of prevention work going on in countries, but what we see, but in reality, there is little accreditation of that, and there's little, not many means to determine if they are really evidence-based interventions that are in place. Another finding that we had was that there are countries that do report that they have provision of needle and syringe programs as one intervention for prevention of HIV and hepatitis C among people who inject drugs, but that number and that proportion stands very low within all the countries and in the different regions. And if we were to look at if those interventions that are placed, if they are in accordance with the WHO, UNODC, UNAIDS technical guide in setting targets, then we see a big gap in those intervention of services. And also in the countries where there are some of those interventions in place, you see a big wide variations in the extent of coverage of those services. And my last slide looks at that we do have a lot of countries that report that they have provision of treatment interventions. But then when you look at how those treatment services are being funded, you see a big differences there. And in many instances, people still have to pay from out of the pocket for treatment, to avail treatment services. And in many countries, you do not find a standard operating procedure on treatment interventions, or to map what are the treatment interventions that are being offered. So again, along with prevention, you see a big gap in provision of evidence-based treatment services. And I think because there is also a question around that, why people think of, there's this debate on abstinence versus, non-abstinence kind of like thing. That essentially comes out of not understanding what treatment of substance use disorders is, and not implementing those evidence-based interventions that, for instance, are based on the international standards of drug treatment. And the same goes for prevention of drug use, because there are those international standards, and if we were to apply them, we would have a different scenario. And my very last slide.
Last slide. Sorry, thanks, Kevin.
Yeah, exactly. My very last slide is that while there are treatment interventions available, you see again a big gap in what kind of services are available, their coverage, as well as how much they are accessibility. So there is a big gap that exists in the availability of services, their coverage, as well as what would entail an evidence-based intervention, either for treatment of or for prevention of substance use, or prevention of prevention of HIV and AIDS among people who inject drugs. So I think one of the rules that, from my perspective, one of the rules that you can really play is that push for countries to have more of that mechanism in place, to have more of the evidence-based services, and to ensure that there is a mechanism to monitor the implementation of those services. That's something that can have more impact than other interventions. So thank you very much.
Thank you so much, Cameron, and also Angela, of course. And yeah, I mean, huge amount of data, and a huge challenge to try and present all of that data in 30 minutes. I really do appreciate, what you've done today for us. I see lots of comments asking for the slides. So the recording from today will go up on the VNGOC website and the Civil Society Unit website as well. But Sarah, I'm assuming we'll also be able to share the actual slides, Angela and Cameron. I'm hoping that's okay. I see nodding, that's good. So we will make those slides available to everybody. So please just do check on the VNGOC website for that information as well. And do continue to use the Q&A. There's lots of questions already in there. We obviously want to focus on questions that are related to the World Drug Report and to the data that you've had presented to you. And I think Angela and Cameron can start to look at those now. Any ones that are answered in writing, you can obviously see those in the Q&A function. We will also capture those. We will also capture those answers and also upload those to the website as well, so that they're not lost. Because I think they're all brilliant questions that we've received so far. So without further ado, I'd like to hand over to the first of our two civil society speakers today. We did an open call for speakers, as we always do at the Vienna Committee whenever there's an opportunity like this. And I'd like to thank everybody who applied to speak. And I'm really pleased that we have two speakers today, one from Colombia and one from Pakistan. And first of all, I'd give the floor now to Pedro Arenas from Colombia, who's going to be talking from Corporation Vismutop. Over to you, Pedro. Thank you so much.
Thank you,
Pedro,
Jamie.
you have around
Good morning in Colombia and good afternoon in Europe. So I will speak in Spanish about what I have here meetings with the campesinos on this point for which I was invited. Thanks to the UNODC and the Vienna NGO Committee for inviting me to this space. Trabajo con la Corporación Vismutop y acompañamos procesos comunitarios en varias zonas de este país. Llevo casi 30 años conociendo de los temas asociados a la producción de coca y hemos revisado la evolución de las políticas contra la coca, como la erradicación forzada y los programas de desarrollo alternativo. Más recientemente hemos estudiado la relación de coca y medio ambiente, entre otros aspectos. En primer lugar, quiero señalar que los pueblos hemos convivido con la coca desde siempre. La coca es un arbusto originario de los Andes y de la Amazonia en Sudamérica. Los pueblos indígenas convivieron y conviven con ella desde hace siglos. La coca, junto con otras plantas, ha sido fuente de alimento. Se usa en ceremonias culturales, tiene usos tradicionales y modernos. De ella también se obtiene la cocaína. En Perú, Bolivia y Colombia actualmente se le usa cada vez más en la pastelería, la panadería y en restaurantes. Los impactos ambientales cuando se siembra en pequeña escala y mezclada con otros cultivos son mínimos. En los años 80 en Colombia, una familia campesina obtenía los ingresos básicos con un promedio de 3 hectáreas de cultivo de coca para pasta a base de cocaína. Actualmente esa misma familia podría obtener algo más que un salario mínimo de 2 hectáreas. Las técnicas de producción son más intensivas y se obtienen más cosechas en el año, al tiempo que se obtiene más alcaloide de las hojas de coca. En los años 80, los cultivos estaban en 4 departamentos, pero actualmente están en 16 de los 32 departamentos que tiene el país. Las políticas antinarcóticos hicieron que el cultivo se extendiera por más regiones. La persecución hizo que se cultive ahora también en parques naturales, reservas forestales, resguardos indígenas y consejos comunitarios afrodescendientes. Casi la mitad de los cultivos de coca están en esas zonas protegidas, pero no hay planes para contenerlos más allá de seguir haciendo lo mismo que se hizo durante más de 40 años. En segundo lugar, la coca como motor de impacto ambiental. Reconocemos que la coca cultivada para cocaína causa impactos ambientales en nuestro país y más allá. Por ejemplo, la producción y hasta el consumo afectan los sistemas ecológicos. Se arrojan residuos contaminantes a las fuentes de agua en los lugares de producción y cada vez se usan más agentes químicos para mejorar los indicadores de productividad. Al mismo tiempo, en varios estudios se encuentran residuos de cocaína en los ríos de Europa. Un ejemplo reciente fue el hallazgo de anguilas alteradas físicamente por los residuos de cocaína en las aguas del río Belfast, en Irlanda. Sin embargo, en el ámbito de la producción desde los entes gubernamentales, se construyó el mito de que el cultivo de coca es el mayor motor de deforestación. Pero en el terreno hay otros fenómenos como la ganadería extensiva de vacas, el acaparamiento de tierras, la construcción de carreteras y la agroindustria. Según estudios en zonas de agricultura legal intensiva, el uso y contaminación de aguas también está afectando más a los ríos por los desechos tóxicos que se arrojan. Esto es algo que debemos estudiar más para conocer y superar los mitos que se han construido contra las comunidades que cultivan coca, con lo cual obtienen ingresos para su subsistencia. Este reporte mundial que nos acaban de presentar acepta que solo el 4% de la deforestación que hay en Colombia lo es por los cultivos de coca. Tercero, en el reporte de drogas 2022 hay impactos ambientales no mencionados. Sin duda, la producción de drogas genera unos impactos ambientales. Si ustedes revisan, el cuadro que aparece en el capítulo 5 menciona 3 rutas de impacto ambiental, unas por cultivo y producción, otras por el uso de drogas y otras sobre las respuestas a drogas.
Pedro, I think we might have lost sound. The interpreter's struggling to hear, Pedro. I think we might have lost. Can anyone else hear Pedro, or is it?
No, I think we lost Pedro.
I can still see you, Pedro, but we've just lost the audio.
Hola, hola.
Yes, now
Hola,
I can hear you.
again?
Please continue. Yes, thank you so much, Pedro.
Oh, sorry. Ok. Decía que las respuestas estatales también a veces causan peores impactos que las mismas drogas. Desde 1961 a nivel mundial, pero en Colombia desde finales de los años 70 y con más fuerza desde 1994, se aplicaron fumigaciones aéreas con agentes químicos para erradicar los cultivos de coca. Estas aspersiones se usaron contra poblaciones indígenas, campesinas y afrodescendientes, con graves impactos en la salud humana, animal y vegetal. Durante 21 años seguidos, con repercusiones en el medio ambiente, que han sido documentadas por la Corte Constitucional y por la Comisión para el Esclarecimiento de la Verdad del Conflicto Armado. Esas fumigaciones aéreas no acabaron los cultivos de coca, pero sí desplazaron personas, afectaron la seguridad alimentaria, causaron más deforestación y contaminaron más los suelos y las fuentes de agua. A esto se suman otras técnicas de erradicación manual forzada, como las aspersiones terrestres de glifosato, las cuales han exacerbado el conflicto socioambiental y han puesto en riesgo la vida de policías y campesinos. Ambas técnicas empujan a los cultivadores más adentro de los bosques, donde ahora son perseguidos y judicializados por cometer crímenes ambientales. A la militarización y la guerra química contra los cultivadores se ha sumado la militarización de las políticas ambientales. Un elemento adicional de contaminación desde las políticas oficiales es el de la destrucción de laboratorios o sitios de transformación de la hoja en pasta base, sin cumplir protocolos ambientales. Casas rústicas que son quemadas por las autoridades junto con los químicos que también son incinerados o vertidos sin ninguna precaución. El informe mundial debería también abordar el problema ambiental causado por las respuestas estatales a través de los distintos programas de erradicación que buscan un mundo libre de drogas. En cuarto lugar, por ser ilegal, la coca se instala lejos del control de las autoridades, causando más impacto ambiental en ecosistemas estratégicos. La prohibición y su persecución ha llevado a los productores a instalarse en áreas remotas del país, como la Amazonía y también en el andén occidental cerca del mar Pacífico. Según la UNODC, Colombia, los 10 enclaves de producción de cultivos y zonas de procesamiento siguen siendo los mismos desde hace casi 20 años, con las mismas causas, las mismas razones y justificaciones esgrimidas por las comunidades campesinas para hacerlo. El cultivo de la coca se siembra en un lugar apartado y en efecto deforesta menos que otras actividades agrícolas o pecuarias, pero reconocemos que ese lugar deforestado luego se convierte en pastos y en praderas para vacas. La frontera ganadera se expande hasta el último rincón de la Amazonía, a donde antes solo llegaba la coca, ahora está llegando la ganadería bovina. Esta causa más deforestación y amplía la frontera agrícola con carreteras. Una familia campesina, como dijimos antes, podría vivir con 2 hectáreas de coca, pero nadie vive con 2 hectáreas para vacas en la Amazonía, ni con 2 hectáreas de caucho o de cualquier otro cultivo sustituto que promuevan los programas de desarrollo alternativo. Así lo muestran los informes del Instituto Colombiano de Estudios Ambientales y la Fundación para la Conservación y el Desarrollo Sostenible. Además, los programas de sustitución de cultivos agenciados por el Estado colombiano o por las propias agencias internacionales de cooperación, entre las cuales se encuentra la UNODC, no han sido sostenidos en el tiempo y en muchos casos, como ocurrió recientemente con los programas de sustitución después del Acuerdo de Paz de 2016, no han cumplido todos los compromisos con las familias campesinas que dejaron atrás por su propia cuenta los cultivos de coca a través de la erradicación voluntaria. Las políticas de drogas simplemente empujan más a la población selva adentro a deforestar más. Los programas de desarrollo alternativo no han cumplido con las expectativas y los compromisos con la población que busca atender. Por último, Por último, y ya con esto termino, algunas ideas. Debemos superar el prohibicionismo y convivir con la coca. Aprender a convivir con la coca. Pagar por comercio justo los productos agrícolas, en particular, revisando los tratados de libre comercio que han afectado a las agriculturas lícitas. Implementar una justa política de pagos por servicios ambientales. Cumplir cabalmente los programas de desarrollo alternativo para que no se conviertan en un incentivo con efectos negativos en lo social y ambiental. Reconocer el gobierno propio de los indígenas y las comunidades negras, quienes han demostrado que pueden cuidar el medio ambiente. Reconocer los derechos del campesinado y sus propuestas de cuidado de las áreas ambientales en las que viven actualmente. Específicamente, debemos trabajar en la reducción de riesgos y daños socioambientales en el ámbito de la producción. Traer ese concepto de riesgos y daños que ha promovido, de reducción de riesgos y daños que ha promovido organizaciones de la sociedad civil al ámbito de los países productores en el ámbito del cultivo. Por ejemplo, dejar de depender exclusivamente de los ingresos de la coca, lo que implica complementar e integrar con la producción de alimentos. Dejar de arrojar contaminantes a las fuentes de agua. Al mismo tiempo, deben suspenderse los programas de erradicación forzada y dar lugar a la firma de acuerdos con comunidades para la contención, reducción gradual y disminución sostenible de los cultivos, con programas de protección de bosques y mejoramiento de los ingresos de las familias cultivadoras. Thank you, Jamie.
Pedro, thank you so much for joining us and for giving us your wonderful, unique perspective, really important perspective. And equally important perspective is our second civil society speaker. I'm very pleased to welcome Christina von Sperling-Afridi, who is speaking to us from the Karim Khan Afridi Welfare Foundation in Pakistan. Christina, I see you there. Lovely to see you again. Thank you again for joining us.
Hello, Jimmy.
Hello, and over to you. Over to you.
Thank you. Thank you. Hello, Jimmy and Mirella, dear colleagues and panelists and participants. Good afternoon. I would like to thank Vienna NGO Committee for giving us this opportunity to share our views on the World Drug Report 2022, the impact of cannabis legalization. So about us, since 2015, KKWF has been working to empower the youth with awareness, knowledge, and life skills that will enable them to avoid the drug addiction trap. We work to equip students with knowledge and awareness, to break taboos through prevention education. Our work rests on 5 pillars to build protective factors for youth and engage with them to make healthy life choices and better identify, understand, and manage emotions. We have the drug awareness primarily, we have environment, sports, arts and culture, and civic sense. These are our pillars. So about KKWF, regularly we use the valuable information and data presented in an annual World Drug Report in its youth prevention education program. It's also used the findings of the report in its policy advocacy activities to promote action to address the challenge of drug use in Pakistan. It promotes the findings of the World Drug Report with various media outlets through writing articles in print media, news coverages of its commemoration of international days related to drugs, and post and social media platform. So we need to monitor cannabis legalization. So drugs, the most destructive element in society, yet the world is witnessing an ever-increasing expansion in variety, availability, and use of drugs, unmatched in previous generations. Cannabis remained the most widely used drug globally. 209 million people used cannabis in 2020, representing 4% of global population. Markets for these drugs are expanding to more vulnerable regions. More and more youth are turning to drugs. 284 million people aged 15 to 64 used drugs worldwide in 2020, a 26% increase over the previous decade. The undeniable social and economic cost of drug use not only hinders sustainable development, but take an emotional toll, stealing the future of its young population and the future of every nation. Cannabis remained the most widely used drug in Pakistan with an estimate of 4 million users. UNODC survey in 2013 stated that Pakistan had 6.7 million drug users with 4 million addicts. Current unofficial estimates show over 9 million users, which represent the highest number worldwide. The survey, no survey since then. Apparently, they are going to start one this year, so 10 years later. So there can be no effective prevention or treatment without recognition of the problem and the necessary funding to address it. In 2020, Pakistan approved the legalization of hemp production for industrial and medicinal purposes. No regulatory framework was set up to monitor implementation, thereby increasing risk of its use for non-medical purpose. Without mechanism for accountability of such policies, cannabis use could further escalate. Drugs in Pakistan are cheaper than food. Due to easy and cheap access, Pakistan has a transit corridor for trafficking from neighboring Afghanistan, producer of 85% of the world's opium in 2021, is victim to the escalating use of drugs, taking the greatest toll on the young population. More youth taking to drugs, 9-year-old children falling prey to deception about drugs. With 130 million youth under 30, the second youngest population in the world today, it is imperative for Pakistan to have a response to drugs, especially cannabis, that puts stronger focus on prevention programs. Young people continue to use more drugs than adults. So we need to monitor cannabis legalization in Pakistan. So a growing population, stigma, absence of drug education within the family and its in education institutions, lack of a stronger national narrative to say that drugs are wrong is fueling the drug menace. Education institutions are now the hub for drug use. In face of these multiple crises, we need to take greater care. Care starts with evidence-based prevention and addressing perception and misperceptions of risk. Role of civil society in partnership with governments is a crucial in spreading programs highlighting prevention in schools. So impact of cannabis legalization or trends indicates cannabis legalization has had a wide-ranging, worrisome impact on public health and safety, market dynamics, commercial interest, and the criminal justice system. 2020 saw an 80% increase in cannabis users from past year, while the number of people using it increased by 23%. From 2019 to 2021, cannabis had broken all records of selling worldwide through the darknet, especially during the pandemic. So seizures of cannabis resin increased to a record of 2020. Seizures of cannabis herb increased substantially in 2020. Countries have not so far proved the benefit of legalization, yet it remains the most widely used drug worldwide. More harm can be caused as compared to unexpected benefits. Cannabis is the most popular drug, accounting for 48% of all drugs sold in value terms globally. Even in Pakistan, cannabis has always been a popular recreational drug among the youth in rural and urban areas. Legalization without regulation and evidence is promoting the glamorization of cannabis and romanticizing the product to lure the vulnerable youth to make profits with no interest to consequences of addiction. Companies which are involved in stimulating this market are subverting the reality for the purpose of profiteering. An international unified narrative highlighting plans to manage increasing public health concern due to cannabis legalization is urgent. Increases have been evidenced in the use of cannabis in terms of potency, amount, use, and frequency of the use in 2020. Cannabis accounts for a substantial share of the global drug-related harm, owing to its high prevalence rates. Simultaneous quadruple confluence of increase in intensity, potency, plus frequency of use, THC content of cannabis products, hospitalizations have all likely interacted to push the upwards trajectory of its use. Some 40% of countries reported cannabis as the drug associated with the greatest number of drug use disorders, and 33% reported it as the main drug of concern for those in drug treatment. So this is a clear long-term trend of increasing THC content in seized cannabis herbs in Europe and the United States. Average THC content of cannabis herbs seized in Europe has increased by almost 40% since 2009, and that of cannabis resin has tripled. In the non-medical use of cannabis, most cannabis products now have THC contents greater than 20%, and cannabis concentrates have THC content up to 70%. Rising THC is and failing CBD levels in cannabis amplify health risks. A higher ratio of THC can increase dependency and the chance of psychiatric comorbidities. So perception on cannabis harm. UNODC research has shown that perception of cannabis has decreased in areas where the drug has been legalized. At the same time, the proportion of people with psychiatric disorders and suicides associated with regular cannabis use has increased, together with the number of hospitalizations. So countries, we believe, need to be held accountable for their policies of liberalization. They must share the responsibility of the addiction and loss of precious life around the world. So way forward, taking action, United Nations agents must prioritize and promote civil society as a soft power to play its effective role against the harm that cannabis and other drugs are having. They must, along with governments, support civil society through financial and policy provision to widely implement prevention. Civil society organization is a powerful voice to take this message to the grassroots level. International civil society needs to come closer to build an alliance to evaluate trends and pursue a solution amplifying the call for prevention. We must use the wealth of information presented in the World Drug Report each year to counter the growing drug problem. The relevance of knowing the number that have increased and harm that is skyrocketing is valuable. Only if accountability is done and needed results are delivered. We need a closer and stronger global coordination to combat this scourge. Impact of cannabis legalization should be evaluated, consequences explicitly spoken and responsibilities identified. Governments should be sharing best practice and civil society organizations should be implemented. Countries need to take full responsibility of legalization impacts as consequences do not remain within the country's border. It becomes a bad example and influence other countries' related decisions. Plans for meeting drug-related SDG targets need urgent attention and action. We need the World Health Organization to continue strongly playing a constructive role for the world free of drugs. Final thoughts, prevention is the only way forward. Need to make youth aware of the dangers of drugs. When prevention grows, traffic is less successful. Prevention for the protection is the only solution for the youth to build up a mechanism of self-defense. We must stop the normalization of drugs. No drugs, no addiction. Thank you.
Thank you, Christine. And and I just want to say again, thank you to all of our speakers, Angela, Cameron, but also Pedro and Christina. I think it's been a really interesting session so far. Loads of questions have come in, and I've seen Angela and Cameron have been very busy trying to answer and field lots of those. I want to come back to a few of them now that we have some time. I'm really glad we have some time to do that. But there's too many to read out every single one by one. And as I say, Cameron and Angela have already written in responses to several of them. And we will capture those responses and make those available after the event as well for the record. But I wanted to come back, Angela, on a kind of cluster of questions, kind of using chair's prerogative, I guess. But a cluster of questions that focused on the youth reporting and the youth aspects in the World Drug Report. And obviously, as you mentioned in your presentation, drug use amongst the young people is such an important part of what's being reported and the story that's being told here. I saw there was some questions about the reliability of some of the government data on this issue, because as you can imagine, young people might be less willing to be open about their drug use to officials. But I saw that you responded to that, Angela, to say that it's an open invitation for any other evidence that's out there. Because I think I want to give you the floor, Angela, just to explain. It's not just government data, right, that you guys are using, but it's supplemented.
Yes, Jamie, we definitely supplement with what we can find. And even the government sources, the government data, if we see that in a way they don't fit, the overall picture, we go back and ask. So it's not that we take unquestionable anything that comes on our way. And it's a good question in saying that even, for example, most of our drug use data are based on household surveys. And it's true that in some countries, some young people are more likely to be open to report than in other countries. And so we have designed a methodology for household surveys with indirect questions to avoid exactly this problem. And so we have implemented this in Nigeria, now we're doing Pakistan, now we're serving Afghanistan, we have done a survey in Guatemala. So we try to overcome some of these issues, but definitely if there is a scientific evidence out there that you have, please send it to us.
Okay, thank you, Angela. And I know, for example, with some of the data that Cameron presented around injecting drug use and HIV prevalence. There is a kind of informal process where civil society is kind of asked to look at that data, you know, not necessarily to reanalyze it, but to look at it and to highlight any challenges. I wonder if you would be open to a similar process, maybe with some of the youth organizations that exist around drugs, to, you know, to kind of for them to be more involved, because I think that's one of the things is that, you know, the data is sometimes presented, but it'd be useful to kind of maybe support that before publication.
Yeah, no, definitely. I understand what you're saying, and that's a good feedback. Let us think, you know, the challenge that we have is that we do the World Report in such a short time.
Oh, yeah.
And you have no idea, I mean, the pressure that we have. And so sometimes we wish we could reach out much more. So it's really a time pressure. But it's a good feedback to say, should we have a process, maybe a better process? And in the review process, we welcome everyone. The only thing that we want to be clear is that there are quality standards. So we are not taking everything everybody give us. So once we make clear, so.
Yeah, I think that's a really important message for people to take home, is that it's, you don't just blindly accept and incorporate all the data you receive. There you are. And I think actually that leads us on to another question which I saw come through, which again, I thought it'd be useful just to give it some airtime, particularly maybe for Cameron, because I know that Cameron, you responded to this in the chat. Sorry, I'll have to check who the question from. I think it was from Alejandro Nieto or something. Apologies if I've got the name wrong. But it was a question about when you're reporting and presenting about the availability of drug disorder treatment, or, you know, drug services and drug treatment. Are you, when you look at that data, are you making any kind of assessment of whether that treatment is in line with the WHO UNODC standards? Or, you know, do you know what I mean? Like when you say that there's this many drug treatment services available, are you saying there's this many treatment services that abide by the standards, or do you not apply that filter?
Okay. In the revised ARQ, which is out there, there are now different modules, and one of the modules, which is a rotating module, which means it will not be going out every year, looks at more in detail the responses. This year, the module looked at the availability of the services broadly. In the next year's module, there will be more information that will look at what is the quality of information. So hopefully you'll be able to tell something more around that. Coming back to the sources of the information, I would really invite the viewers and, you know, all the participants to just look at the end notes at the end of each chapter of the World Drug Report and see the number of references that are there to other literature and other sets of information. And it's not just the World Drug Report. I mean, the references for cannabis legalization came out of, there are more than 100 references to just that one section, that references to the literature. So it's much more rich than just the official data that is reported.
And as Angela said, if people examine that, look at the references, and if people know of other sources and other studies out there, from what I can tell, Cameron and Angela, this is an open invitation to share those. And I already see some people have been doing that in the chat and in the Q&A, which is really welcome as well. What might be great, actually, I don't know if it's a liberty to ask, but maybe Cameron or Angela, if you could maybe put your emails into the chat so that people have that contact readily available, I think that would be really useful. So I also, I am conscious of time as well, but and I've kind of taken the liberty of reading out questions rather than giving people the floor, just to save time at this stage. I hope people will forgive me for that. I want to come back to a question that's actually submitted by Juan Fernandez Ochoa, asking about you mentioned as well, Angela, you know, that there's policy recommendations in the World Drug Report, and I think you presented some really interesting analysis on kind of forced eradication and things like that. It's really great to see that in the report, and I think that's a huge development compared to previous years. You know, that's really good to see. There was a question about like the lack of recommendations specifically regarding human rights and policies, and I know you did respond in the chat, but I wonder if you can just say a few words about that, either Cameron or Angela, now.
So
and what you're doing,
again,
I'll look at the other questions.
Yeah, I mean, we try to match the policy response to the precise problem. So, and the messages and the things that we highlight are not everything related to drug policies, of course. It's just that we say, you know, because we felt that, you know, writing a lot and rehashing the old messages that we continue to say, etc., was less sharp. But doesn't mean, of course, that we don't value other things that we do. I mean, on the human rights, I mean, for example, there has not been a call to, you know, for example, you would also not see, well, countries should stick to the International Convention on Drugs. There is not such a, also because it should be INCB role, etc. So I understand the comment is like, why you don't see, so in that respect, that's why there's not also a generic call to say, you know, we all have to follow human rights, not because it's important, one and the other. They are both equally important. It's just that, you know, we wanted to be more focused, but there are plenty, as I said, of documents where you will find issues on, you know, recommending the moratorium to the death penalty. You will find a lot of recommendations on the, you know, on the proportionate response to the drug problem. For example, and by the way, one element that I can tell you that for me was something that I learned and that I'm sure you will find useful. When we provide the definition of definition, we explain decriminalization, depenalization, we clearly say what INCB has recently said, that the decriminalization of drug use and the possession of drug use and the decriminalization of you know, small offenses is within the drug convention. So that, even if it's not in the formal recommendation, I think is an important information that I think this community could definitely use.
Thank you, Angela. I have to admit, I haven't looked at that terminology section. I've made a little note to myself. That's the first thing I'm going to do when we finish this. So thank you for kind of signposting that in particular. I think that's great. I think one very last question before we let you go. I see it in the Q&A section now. It's from Kenneth Anator. Again, I apologize if I'm mispronouncing names. Any data available or maybe any narrative in the World Drug Report around the connection between drug use and gender-based violence? I think the question is about Nigeria and West Africa or Africa, but I think actually it applies more broadly as well. Just wondering if that's something that is touched on, or if that's data that you've ever considered or maybe considered for the future.
There is a small reference when we try to explain why we have these gender differences. And we say, for example, that women progress to drug use disorder faster than men. But we took that, and there is actually also a box on the impact, for example, of COVID on women. But where you can find a much wider analysis of this is in a booklet that we did. Cameron, do you remember? Sorry, I have Cameron in front of what year was it? Where we actually, and we speak about the impact of violence to women and the impact on the linking with the drugs and also the relationship with partners. So we have a dedicated booklet.
Yeah, if you look at the World Drug Report 2018, there is a booklet which is dedicated to drugs and women, and it does talk about the pathway of substance use and substance use disorders among women. And there was a major section in there which talked about gender-based violence and substance use, as well as adverse childhood experiences, especially, and how it affects more women than men, kind of thing. So if you can look at, because also it's not possible to cover every topic each year. So like I said, if you go back to 2018, you'll find a wealth of information on women and drugs in that World Drug Report.
Okay, amazing. Thank you again. Really appreciate it. One very last thing, I saw a question in the chat from Lucia. The terminology guide that we talk about, that's in booklet. Is that on the Cannabis? So it's which
Yes.
booklet is that? Sorry, Angela, you have to.
Booklet 3.
Booklet 3.
I think it's
So
the
if
pink
anyone-
one, the light pink one.
Okay, so if anyone wants to go and look at that now, like I'm going to do, download the light pink booklet 3. Yeah,
And there is a
fantastic.
reference to the INCB report, so you can
Yeah.
find also similar in the INCB report.
Really useful, as has the entire session been. So I think just finally for me to say again, a huge thank you. We've had more than 150, 160 people on this call, on this webinar, which is brilliant, from all over the world. Brilliant questions, loads of discussion, wonderful presentations. So thank you, Angela. Thank you, Cameron. Thank you, Pedro. Thank you, Christina, as well. Really appreciate your inputs. And yeah, let's definitely do this again, next year. I know you don't want to think about next year's report. You just want to rest now. But thank you so much. Really appreciate your time. And please do follow up. It's our job as civil society to follow up with Angela and Cameron. And, Mirella's team are there to help if they can. And the NGOC are here to help if we can. That's what we are all here for at the end of the day. So do please keep following up and, keep this conversation going. So thank you. And thanks everyone, and enjoy the rest of your day, however long there may be left of that day. Thank you.
Thank you. Bye.
Thank you very much. Bye.
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 Thank you.